Welcome back to Beyond the Stethoscope. Kicking off this season, we welcome Trinity Health Mid-Atlantic internist, Dr. Cheryl Jackson, who will break down the differences in primary care and internal medicine and how both play a part in addressing social determinants of health. Thank you for joining us today, Dr. Jackson. It's so great to have you here to kick off the season.
Thank you for having me.
Can you tell us what primary care is and how it relates to internal medicine?
Well, primary care is really the first contact of care, and it can be provided by different specialists like family medicine or internal medicine or even pediatrics, but we kind of focus on different patient populations. So for family medicine, traditionally the training is a little different from mine, which as an internist, I generally see patients over the age of 18 and above, whereas family medicine can see patients from pediatrics all the way up into geriatrics. But our training is a little different in the sense of, as an internist, most of my training and residency was centered in the hospital because we really take care of complex adults. Mm-hmm. And from the specialty of internal medicine derives a lot of subspecialties, like you have to be an internist first before you become a cardiologist or a nephrologist or endocrinologist or rheumatologist. So these are, so I'm a general internist. Mm-hmm. I did not subspecialize because I treat all of those subclasses of patients.
Oh, thank you for explaining that to me. Can you explain the main differences between internal medicine and family medicine and why you choose to specialize in internal medicine?
Sure. Really, the differences is that, internal medicine, first of all, it's really getting into the complexities of disease. Mm-hmm. And so it's really a deep dive into very complex diseases in terms of diabetes, stroke, heart disease, myocardial infarctions. And so I chose to do that. I chose to really specialize in terms of adults only, mm-hmm. But really do a deep dive into those complex diseases, multi-system disease.
What are some of the most common conditions you manage as an internist that might differ from what a family medicine doctor would see?
Well, I think because we don't see kids, mm-hmm. Family medicine may see pediatric patients from birth until that. And so for patients 18 and under, I would not see. So our focus is a bit different in terms of they have a wide scope of patients that they would see, but I would think that our training in internal medicine is that we see adults only, but really complex adults. Our specialty really is geared towards those critically ill patients who we can treat in the outpatient setting.
When would it be important for a patient to see an internist over a family doctor?
I think I don't want to make too much of a distinction between the both in terms of, I think family medicine can be quite comfortable in seeing some patients that probably have lower complexity. Family medicine focuses on a lot of prevention, whereas internal medicine, yes, we do in preventative health a lot, mm-hmm. But really complex diseases is where we thrive.
Yes. How do social determinants of health, such as income, education, and access to healthy food, impact your patients' overall health outcomes?
It's huge. I think that, only 20% of the care that we provide in terms of medical care really determines the patient outcomes. The other 80% is social.
80% is
80% social determinants of health in terms of how our patients are going to have healthy outcomes. So access to food, health literacy in general, education, jobs, lack thereof, mm-hmm. where they live, the zip codes in which they live, poverty, transportation, all of these have just as important and even more effect on our patients' our health outcomes. And so for us to be able to deliver effective care, we have to address all of those issues.
Which leads me into my next question. Research has shown that life expectancies can vary significantly
Yes.
from one zip code to another, even within the same city or region. Can you share your insights on the local disparities in care that contribute to these differences? What are some of the factors that some of the factors at play, and how do you address disparities in your practice?
Well, that's a long question.
I know.
but certainly it's very relevant. In Philadelphia alone, 1 mile zip radius, there may be a difference in 20 years in terms of mortality.
20
In
years.
terms of life expectancy, I should say. 20-year difference in life expectancy in 1 mile radius in some of our Philadelphia regions. And a lot of that has to do with violence, poverty, access to care, even access to healthy food sources, schools, education. All of these impact that. Now, what do we do from a point of view? How do you address that? I think our approach in primary care is not just to treat the disease, it's to treat the people who have the disease. And so, it may be that we treat diabetes, for example, but it's not just treating the diabetes. It's a person who has diabetes who may have issues with access to getting insulin, maybe issues with transportation, getting back to their doctors or to be able to see their specialist. And so studies have shown that if you are able to provide, for example, transportation for patients who may not have transportations, or to be able to help them access resources like food or
Right.
social
So
work
important.
needs, or even behavioral health needs. These are things that we try to address. I mean, just today, I was working with a care team of nurses, behavioral health specialists, community health worker. All of us are discussing how can we help that patient. Less of our discussion was about the medical issue that patient had, because all the other issues of transportation or poverty were really impacting that patient's health. And so we really needed to have a team-based approach to addressing that so our patients would have a better outcome.
Yeah, that's good to know. I guess you see a lot of that in your clinic.
Yes, we do.
So what, in your opinion, could make health outcomes better for a population in the Philadelphia metro area?
Well, one is, studies have shown that access to primary care can do many great things for a population. It's not just about treating a person, but it's how does our population, how is healthy. The health of our population is important. And so I think primary care access has shown to decrease the cost of care. It has shown to improve the quality of care. It has been shown to increase the health of our population. So one is access. Two is to think as a health system to go beyond just the medical care, but to support them with community services. Trinity Health has a whole division in community health and well-being that works closely with our primary clinics in terms of providing increasing access to care or
Transportation.
Absolutely. We've even had a program I was involved in which we had healthy food delivered to the clinic, and the patients would come and pick up fresh produce, because in the Philadelphia area where I work, they were not really having access to healthy food choices. And that was a very, very popular program that we had to bring fresh food to the clinics that they would pick up.
Yeah, not too many people, I think, are aware of our community health and well-being program, which, as you said, does help with transportation, providing healthy meals for individuals who maybe do not have access to that.
Absolutely, yes.
So it's so important.
Yes.
And I want to thank you and your whole team for all the care, not only, the medical care, but also for working on the other issues that they are experiencing that kind of interfere with them getting the proper care.
Yes.
So thank you so much.
Thank you.
Thank you, Dr. Jackson, for joining us today to kick off our new season. It's never too late to schedule your annual checkup. If you need to find a new primary care doctor, visit the website in the description below. We'll see you in the next episode of Beyond the Stethoscope.